Hello everyone, welcome to Medit World. Myself Dr. Ayush Gupta. This is the part 2 of my series on rapid fire anesthesia. I would request you all to first see the first part for complete understanding of the subject. Now let's begin with anesthetic agents. The anesthetic agents are drugs for general anesthesia, local anesthetics, and muscle relaxants. The general anesthetic drugs are inducing drugs, which are generally given by intravenous route, and maintenance drugs. Which are given by inhalational route. First, we are going to see about induction drugs. The first drug in this category is thiopenton. Thiopenton is a barbiturate, that is, it stimulates GABA. It is induction agent of choice in neurosurgery and hyperthyroidism. Because it inhibits the conversion of T4 to T3. The termination of action of thiopenton is by redistribution. Thiopenton is contraindicated in porphyrias. It is also contraindicated in the patient of asthma because it can lead to bronchoconstriction. The metabolism of thiopenton occurs in liver. The metabolism of most of the anesthetic agents occurs in the liver. If accidental injection of thiopenton is given intra-arterial, place the IV cannula in original position. Do not change the position of cannula or remove the cannula, and give lignocaine, or you can also give pepavirin. Thiopenton also about seizures. The next drug we are going to see is etomidate. Etomidate also stimulates GABA. It is choice in cardiac surgery, adverse effect includes myoclonic jerks and, very important for the exam, adrenal suppression. It is the most frequently asked question. It causes adrenal suppression because it inhibits 11 beta hydroxylase. The next drug is propofol. Overall, most commonly asked drug is propofol. Propofol stimulates GABA. It is painful on injecting. It is avoided in egg allergy. It is milky white in color. The dose of propofol is 1.5 to 2.5 milligram per kg. If the dose exceeds 4 milligram per kg for more than 48 hours, it can lead to propofol infusion syndrome. It is anti-emetic and antipruritic in nature. Once opened, we have to use within 6 hours. The next drug in this category is ketamine. Ketamine is the only drug in this category which acts by NMDA antagonist. It increases the heart rate, it increases the blood pressure, it increases the intracranial pressure, it increases the intraocular pressure. All the pressures are increased by ketamine. Therefore, it is preferred in patients of shock and hypotension. Most of the anesthetic drugs are not given on full stomach, but ketamine is the exception. It can be given in emergency or full stomach. Ketamine is preferred in patients of asthma because it causes bronchodilation. Remember, thiopenton was contraindicated in the patient of asthma. Ketamine causes delirium and dissociative anesthesia. The term dissociative anesthesia means that a person feels like he is seeing himself away from his body, like a movie. This dissociative anesthesia is due to thalamocortical dissociation. Next, we are going to see about inhalational agents. The first inhalational agent is halothane. Halothane is preferred in asthmatics. Remember, if halothane is not in the option, then the second best answer here is sevoflurane. Halothane is used in internal and external version. Halothane causes arrhythmias and halothane hepatitis. This is due to antibody formation. Halothane causes maximum increase in intracranial pressure. It is avoided in cardiac surgeries and postpartum hemorrhage. The second drug we are going to see is isoflurane. Isoflurane is preferred in liver surgery and neurosurgery. According to the recent updates, this answer is changed to sevoflurane. Isoflurane causes coronary steal phenomena. The next drug is sevoflurane. Sevoflurane is sweet smelling. It is preferred in children, daycare surgery, and cardiac patients. It forms compound A, therefore it is nephrotoxic and avoided in renal failure. The next drug is enflurane. The only point you want to remember about enflurane is that it is contraindicated in epilepsy. The next drug is desflurane. Desflurane is fast inducing drug, therefore it leads to fast recovery. It has lowest blood gas partition coefficient. It is preferred in renal issues. Because it is least eliminated by kidneys. The bad points about desflurane is it is irritant and it causes maximum greenhouse gas effect. The next drug in this category is nitrous oxide. The good points about nitrous oxide is it causes second gas effect or we can say dilutional hypoxia. It has an analgesic effect. It decreases the inhalational agent requirements. The bad points about nitrous oxide are it increases pressure in closed cavities, like brain, middle ear, or obstructed bowel. One exam point is about Antonox. Antonox contains 50% oxygen and 50% nitrous oxide. The last drug in this category is xenon. Xenon is an ideal agent. It can be used in patients of malignant hyperthermia. It is very expensive, therefore it is not easily available. It has lowest blood gas partition coefficient. If the question is asked about the lowest blood gas partition coefficient and both xenon and desflurane are an option, go for xenon. But xenon is not very much available, therefore desflurane is a better answer. It is non-irritant. It has analgesic effect and it does not produce any greenhouse gas effect. It is not metabolized by liver or kidney, making it an ideal agent. Xenon acts by NMDA receptors. Next, we are going to see about MAC and BGPC. What is MAC? MAC stands for minimum alveolar concentration. MAC is minimum concentration required in the alveoli to produce anesthesia. MAC is inversely proportional to potency. If the MAC increases, the potency will decrease. The MAC of different inhalational agents are: for sevoflurane, the MAC is 2. For desflurane, the MAC is 6. For isoflurane, the MAC is 1.4. For halothane, the MAC is 0.75. For nitrous oxide, the MAC is 104. It is the maximum MAC of inhalational agent. Therefore, the least potent inhalational agent is nitrous oxide. The MAC of methoxyfurane is 0.16, which is minimum. Therefore, it is the most potent anesthetic agent, but we do not use it because it is nephrotoxic. BGPC stands for blood gas partition coefficient. It is inversely proportional to solubility of a drug. The highest BGPC is of methoxyfurane. Therefore, it is slowest acting. The lowest blood gas partition coefficient is of xenon. If xenon is not in the option, mark desflurane. Next, we are going to see about skeletal muscle relaxants. The skeletal muscle relaxants is of two types: centrally acting and peripherally acting. The centrally acting drugs depress CNS. The drugs includes the drug which stimulates GABA A, which is diazepam or any other benzodiazepine. The drug which stimulates GABA B, which is baclofen. The drug which stimulates alpha 2 receptor, which is tizanidine. And the drug which inhibits polysynaptic reflex, which includes mifencin. The drugs acting peripherally are further divided into two types: depolarizing muscle relaxants and non-depolarizing muscle relaxants. The depolarizing muscle relaxant are also known as non-competitive muscle relaxants, and the non-depolarizing muscle relaxants are also known as competitive muscle relaxants. The depolarizing muscle relaxants include drugs like succinylcholine, also known as scoline. It is the shortest acting muscle relaxant because it is metabolized by pseudocholine esterase. The concentration of pseudocholine esterase in body can be measured by Dybukane number. Scoline is contraindicated in nerve and muscle injury. Because it increases the potassium concentration in our body. Scoline can precipitate malignant hyperthermia. Swelling leads to fasciculations, which can cause post-operative muscle pain. Next, we are going to see about the non-depolarizing muscle relaxants. They act by blocking NM receptor. They release histamine, which can lead to bronchoconstriction and hypotension. There are two groups of non-depolarizing muscle relaxant, which are curium drugs and curonium drugs. The curium drugs includes atacurium, cis-atacurium, mivacurium. Atacurium and cis-atacurium are eliminated by Hoffman elimination. The term Hoffman elimination means that they do not require liver or kidney for their metabolism. The curonium drugs include pancuronium, pipecuronium, bicuronium, rocuronium, and rapacuronium. The difference between curium and curonium is the curium drugs release less histamine, but the curonium drugs do not release any histamine. For atacurium and cis-atacurium, atacurium releases histamine and cis-atacurium releases negligible amount of histamine. There is a risk of seizures with atacurium because it produces a compound which is known as laudanosine. Next, we are going to see about reversal agents. The reversal agents are neostigmine and sugammadex. Neostigmine stimulates the NM receptor to cause reversal of action of muscle relaxants. Sugammadex directly binds to muscle relaxants to cause the reversal. The resistant muscle for the action of muscle relaxants is diaphragm. The most sensitive muscle for the action of muscle relaxant is small muscles of hands and eyes. The longest acting muscle relaxant is pancuronium. The drug of choice for rapid sequence induction is succinylcholine because it is fastest acting. The shortest acting muscle relaxant is for depolarizing muscle relaxant. The answer is succinylcholine, and for non-depolarizing muscle relaxant, the better answer is gentacurium. If gentacurium is not in the option, mark mivacurium. Overall, the shortest acting is succinylcholine. The most cardiostable muscle relaxant is vicuronium. A very important question is, which is the most common nerve used for clinical monitoring of neuromuscular blockade? The answer to this question is ulnar nerve, which is checked by TOF monitor. TOF stands for train of foot. The next topic we are going to see is about local anesthetics. The mechanism of action of local anesthetics is by inhibiting the inward sodium channels. They can be of two types, esters and amides. The example of esters include cocaine, procaine, chlorprocaine, tetracaine, and benzocaine. The example of amides include lignocaine, bupivacaine, prilocaine, etidocaine, ropivacaine, and dibucaine. The esters are short-acting, all causes vasodilation except cocaine, which causes vasoconstriction and lead to hypertension. The most common used local anesthetic is lignocaine. The shortest acting local anesthetic is chlorprocaine. Prilocaine can cause methemoglobinemia. Bupivacaine is most cardiotoxic. To prolong the action of local anesthetic, we add adrenaline in the concentration of 1:1 lakh to 1:2 lakh. Adrenaline is not injected in the areas of and arteries like pinna, tip of finger, tip of nose, or penis. Next, we are going to see about LAST. LAST stands for local anesthetic systemic toxicity. The local anesthetic systemic toxicity is a rare but potentially life-threatening complication that can occur when local anesthetics are administered in excessive amounts or accidentally injected into the blood vessel. The symptoms of local anesthetic systemic toxicity includes CNS depression, like confusion, seizures, or cardiovascular effects like bradycardia, hypotension, arrhythmias. The treatment of last includes we have to stop the local anesthetic and provide supportive care for airway management and cardiopulmonary resuscitation. And the drug of choice is 20% intralipid. Next, we are going to see about malignant hyperthermia. Malignant hyperthermia is autosomal dominant. Patient have positive family history. It is due to ranitidine receptor mutation. As soon as we inject an anesthetic agent into the patient of malignant hyperthermia, the patient suffers from fever, arrhythmias, tachycardia, tachypnea, hypercapnia, the treatment of malignant hyperthermia includes a drug which is known as dantrolene, which inhibits ranitidine receptor. Apart from dantrolene, we also have to give supportive care to the patient. Next, we are going to see about the gas cylinders. The blue color gas cylinder is of nitrous oxide. The black cylinder with white collar is for oxygen, and the grey cylinder is for carbon dioxide. Next, we are going to see about the pipeline color. The black color pipeline is for air. The yellow color pipeline is for vacuum. The blue color pipeline is for nitrous oxide, and the white color pipeline is for oxygen. Next, we will be seeing about the vaporizer color. The red color vaporizer is for halothane. The purple color vaporizer is for isoflurane. The blue color vaporizer is for desflurane. This vaporizer has a special name known as Tech 6. The yellow color vaporizer is for sevoflurane. The amla cream contains 2.5% lignocaine and 2.5% trilocaine. This was all for this video. Subscribe for part 3. Thank you.